Hi, it's Dr. David Green, founder and CEO of R3 Stem Cell, the global leader in regenerative therapies. All right, today we're talking about stem cell treatment for inflammatory bowel disease in Turkey. Now, we have a first-rate clinic in Istanbul, Turkey, that offers stem cells and exosomes that are the highest quality globally for these types of treatments. Now, today I brought with me Colin the colon. And if you look at Colin the colon, you can see that he ain't happy. Why? Because with ulcerative colitis or Crohn's disease, which are under the umbrella of inflammatory bowel disease, a lot of times traditional treatments either A, don't work well, or B, they have so many side effects that patients cannot tolerate them. Up to half of individuals who are trying to get relief from inflammatory bowel disease cannot tolerate, or they don't want to take so much of these medications because they typically are immunosuppressive. It can open you up to many other issues with infections and side effects, all right? So how are stem cell and exosome therapies different/better for ulcerative colitis and Crohn's? Well, good news for Colin. If you take the stem cells and exosomes for inflammatory bowel disease, it's a very straightforward opportunity. It's an intravenous infusion in the arm. We don't have to inject directly into the bowel. Now, if an individual has anal fistulas or something like that, yes, we can also do direct injections to help those resolve. But one of the things that stem cells and exosomes do, when they circulate through the body, they seek out inflammation. Now, obviously, Colin is having a lot of inflammation throughout the bowel. So the stem cells and exosomes will go to those areas, and our outcomes mirror those in the peer-reviewed research globally, which has shown amazing benefits for individuals who are experiencing, like Colin, immense symptoms, or side effects from traditional medications. Now, the side effects from stem cells and exosomes are typically mild to moderate and short-term, such as maybe a low-grade fever, maybe feeling like you have the flu for a couple days, possibly some chills, lightheadedness, dizziness. Now, the good news is that in Turkey, as well as around the world, the clinics we have in the 8 countries that we're in, we have not seen a deep infection. We have not seen a disease transmission. We've never had a rejection therapy. And we're talking about 27,000 stem cell and exosome therapies globally. A lot of patients are able to either A, immensely decrease the amount of traditional medications that you take. B, we've had plenty of patients who've been able to stop them altogether, all right, and get into remission. And it's a very heartwarming and beautiful to see. We see it a lot, all right? Is it a definitive one-time cure? No, it's not. Most patients do end up needing a repeat therapy every 1 to 2 years. That's normal. But wouldn't it be great to not need those steroid or immunosuppressive medications that are so harmful to one's quality of life and often cause bigger problems than they try to help, right? With just an IV therapy once a year, and you can, put the problem into a very, very manageable state. With an increased quality of life, not having to deal with it, the ability to, have a more enjoyable diet, not have to worry about, is this the day that my pain is going to get ridiculous? All right, so visit us online today at r3stemcell.com. There are hundreds and hundreds of educational videos on our YouTube channel, quite a few success stories for inflammatory bowel disease as well. Call us today to get your free consultation set up for Turkey at +1 844 GET STEM, or email us at info@r3stemcell.com. Thank you.